Good evening, everyone. As Rochelle said, my name is Cynthia Luer. I'm a registered nurse and certified diabetes educator working for Valley Home Care. We see patients in the home, and my colleague Leslie Schifrin and I also teach a diabetes self-management class. Right now, we're doing it virtually, as you can imagine, but we're big believers in diabetes self-management. So we've entitled our presentation tonight "In the Driver's Seat." And I hope by the end of the night, you feel a little bit more in control of your diabetes, and you feel able to make the steps that you need to make to really take control. So we'll get started. The AADE, which is the American Association of Diabetes Educators, has come up with 7 key areas that are considered self-care behaviors that will allow you or help you to manage your diabetes. I'm a big believer in really taking control of your diabetes. I know it can be a very overwhelming and complex disease, and it can be challenging to manage. So I really want you to take some information away from tonight, and that will help you manage your diabetes in a good, healthy way. So we'll start with everyone's favorite topic, healthy eating. And I know this can be very challenging around the holidays, but there are some things that you can do to really make it a little bit easier for yourself. So consistent but moderate carbohydrates are the key to really managing your diabetes. What are carbohydrates? Carbohydrates are your starches, things like fruits, milk, yogurt, beans, lentils, any kind of bread, pasta, rice, bagels, pizza. Everybody always says, those are my favorite things to eat. You can have them, but it's all about moderation. So for most people, we recommend, for men, it's about 45 to 60 grams of carbohydrate per meal. And for women, it's about 30 to 45 grams of carbohydrate per meal. By knowing those parameters, it gives you a little bit more information so that you can kind of see where you're at every meal. You can read the labels, and we'll talk about how to do that. And that would give you the information that you need to kind of really keep those carbohydrates in good control. So again, there's nothing that you can't eat. It's all about how much are you eating. So if you try to stick to those parameters, that should really help you to manage your blood sugars. It's important to eat a variety of foods. We want you to have some vegetables. We want you to have proteins, fruits, whole grains, dairy. All of those foods are important for a healthy diet. We want you to minimize the amount of added sugar, saturated and trans fats that you're consuming, as well as sodium. So in terms of reading labels, what you want to do is you want to look at the serving size. This is very important. If you take a food like cereal, people think cereal is a healthy food, and it can be, but it has a lot of carbohydrate in a small amount oftentimes. So if you read the serving size at the top of the label, that will tell you how much food we're talking about. So for a lot of cereals, the serving size can be 2/3 of a cup to a cup, which is not a lot of food. And then you want to look down at the total carbohydrate. Those are the two important things that we're looking at when we read a label. The total carbohydrate will tell you how many carbs are in that particular serving of food. So for, let's say, Cheerios, the serving size may be a cup. Within that cup of Cheerios, it's oftentimes about 24, 25 grams of carbohydrate. So that's, a decent amount of carbohydrate for kind of a small amount of food. Then you have to consider the milk and if you're adding any fruit to it. So it's not that you can't have it, but you want to know how much is it okay for you to consume. So again, for women, approximately 30 to 45 grams per meal, and for men, about 45 to 60 grams of carbohydrate per meal. For snacks, you can do snacks as well, usually about 15 to 20 grams of carbohydrate per snack a few times a day. So if you track your food, it really helps you to see how much you're eating and what the effect is on your blood glucose. And we're going to talk about testing in a little while. But it's really important to pay attention to what you're eating, read the labels, consider measuring your food. Sometimes it helps to see exactly what we're consuming. Oftentimes we're eating a lot more than we think we are. And it helps to really kind of measure it and track it so that you can see where maybe you need some cutting back. You might want to consider getting a food scale. There's a product called Perfect Portions, which allows you to take a food like a fruit where it's hard, it doesn't have a label, so you can't really tell exactly how much carbohydrate is in a particular type of fruit. But by using this scale, it allows you to enter a code and then measure that particular food, and it will tell you exactly how many carbohydrates are in that piece of fruit. Now, if you don't want to do that, that's fine. You can really Google any particular fruit and it'll tell you how much carbohydrate is in, let's say, a small apple or a serving of strawberries, so that you get a handle on what you're eating and how much carbohydrate it contains. So again, eating is fine, it's healthy. We want you to eat consistently, and that consistency is important too. The body likes consistency, so you don't want to eat breakfast and then skip lunch and then eat dinner late. The body kind of doesn't do well in that kind of a situation. So we want you to have your breakfast, your lunch, your dinner, eat your carbohydrates, but in moderation. That really is the key. And tracking your food really helps you to see what's going on throughout the day. All right. Another really key important part of controlling your diabetes is activity. Being active is so important. Doesn't mean you have to join a gym or run a marathon, but we want you to think about moving. Moving is so important. Decrease the time you spend sitting. They say now that sitting is the new smoking, which means, that there's a lot of health detriment to just sitting all day long and not getting up and moving. We really want you to consider being active. Why is that important? When you're active, your body uses sugar for energy, so it helps to decrease the amount of blood sugar that you have. It also helps to decrease your body fat, helps you to lose weight if that's something you need to do, increases muscle strength and endurance. And that's really important, especially as we get older. We really want to make sure that we have the strength not only to, lift weights and be in the gym, but also to lift your groceries and to be able to get up and out of the chair and do all the activities of daily living that are so important to our lives. So, increasing your muscle strength and your endurance will help with that as you get older. It also helps to decrease your blood sugar, right? When we're active, again, it uses up sugar for energy. So that really helps to keep your numbers in good control. Decreases your cholesterol, decreases your blood pressure, improves your mood, makes you feel better, and decreases stress and anxiety. And I know today, we're really all under a lot of stress, and just being active and maybe taking a walk around the block really helps to make you feel better. So if you haven't been exercising, it's always a good idea to check with your doctor to make sure that you can start some type of a program. And we want you to start slowly. We don't expect you to jump in and, do something really intense right away. We want you to start slowly, increase gradually over time. They say that about 30 minutes of activity 5 times a week is the goal, but you want to start slowly. Start with 10 minutes walking around the dining room, even if it's not a good day to go outside. Just being active, do anything is better than nothing. So think about, what did you like to do when you were a kid, right? A lot of people say they don't exercise because they don't have the time, it's boring, it's not something they enjoy. But think about, what did you like to do as a kid? Were you maybe somebody that got on your bike and rode around the neighborhood? Maybe a stationary bike would be a good idea for you. Or maybe you were somebody that joined teams and you played basketball and softball. I understand that that's not something we're doing right now, but think about that down the road when everybody gets back out in the world. It might be fun to see if there's any teams that you could join. Anything that you used to do that you enjoyed. Gardening, just walking. If you have a dog, taking the dog for a walk. All of those things are really good for you, good for your health, and will help to keep things in good control. They say that, exercise is kind of the key to really living a long life. And if the benefits of exercise came in a pill, we'd all be taking it. So it really is impactful. Again, start safe, start slow, check with your doctor before you begin. With diabetes, we really want to make sure that, although it's good to lower the blood sugar, we don't want to lower it too much. So we usually recommend testing your blood sugar before you start the activity, and perhaps afterwards if you are somebody that's testing, just to make sure that the numbers are staying in good control. We also would like you to carry a snack with you if you're going out for a walk or going to the gym, because we want to avoid low blood sugar. If that sugar does drop, you want to be able to treat it, right? Low blood sugar comes from not eating enough. It can come from extra activity, too much medication, but we want to recognize the symptoms and treat it right away. Symptoms of low blood sugar would be things like shaking, sweating, rapid heartbeat. Sometimes that happens from exercise too. So you just want to be prepared with a snack so that you can treat it if need be. Sometimes we recommend wearing medical alert jewelry, which is just a bracelet or a necklace that can signify that you have diabetes, so that if you have a situation where you're feeling shaky and somebody comes along, they would know to look for that and to help you. But really, you know, most of the times you're going to start slow, and that shouldn't be an issue. It's just more about being prepared. Okay, so activity is something I really encourage you to consider doing. And now we'll talk about monitoring. Checking your blood sugar is really important. I know a lot of people don't check and they don't feel it's something they want to do, but I feel like knowledge is power. So when you know what your blood sugars are running, it really gives you that information to make changes if need be. It helps you to meet your goals. It helps you to see where you might need to make some changes in what you're eating. Perhaps the medication needs to be adjusted. Again, it gives you actionable information. So I really feel if you're not testing, it's something you should discuss with your doctor. Blood glucose monitors are all pretty universal. I usually recommend checking with your insurance company to see what they consider their preferred meter. So you'll get more money back from your insurance company if you're using the meter that they like you to use. But again, it really gives you a lot of information. So what we recommend typically is to test if you're not taking insulin, you're just on medication, oral meds, or not taking any meds. Once a day is enough, but I encourage you to vary the times that you're testing. So in other words, one day you would test before breakfast, the next day before dinner, and that'll give you some good overall information. It'll help you to see how you're doing both ends of the day. If you are taking insulin, we recommend 3 times a day, perhaps 4, depending on what your situation is. Usually we recommend testing before meals, although testing after a meal can be helpful as well. If you're going to do that, we recommend that you wait 2 hours before testing to allow the body to process the food and then see how quickly your sugar comes back down to normal. So what are some ranges that we look for? Before a meal, typically we would like your sugar to be somewhere between 80 and 130. If you're testing after the meal, again, you would want to wait the 2 hours, and 2 hours after the meal, it should be below 180. I also encourage you to speak to your doctor and ask what are your particular ranges, because depending on your age, your activity level, medications that you're taking, the doctor might want you to be at a different range. So it's always a good idea to check and see what they do recommend. But those are general numbers. We really want you to keep the sugars as much within range as you can. That will help you to avoid complications down the road. So the other thing that you might want to consider if you are taking insulin is think about a continuous glucose monitor. I'm sure you've all seen the commercials on TV for perhaps a Freestyle Libre or the Dexcom. Those are sensors that you would wear that get changed every 2 weeks or so, and they are continuously measuring your blood glucose. And it's really nice because it can alert you if your sugars are running low or running high. And it eliminates the need for the daily finger sticks, which some people don't like. So again, continuous glucose monitor would be something to check with your doctor about and see if that's a product that would be good for you. Besides monitoring your blood sugar, we would also like you to consider monitoring your blood pressure. When you have diabetes, it does put you at risk for other diseases. So it puts you at a higher risk for heart disease, for kidney problems, for foot problems, for vision problems. So those are all things we want you to be monitoring on a regular basis. So blood pressure, weight, your lipids, which are your cholesterol, your HDL, your LDL, we want to make sure those are in good control. Sleep patterns, make sure you're getting enough sleep, and for your health, that's really important as well. So getting back to the blood sugar monitoring, couple tips. Always wash your hands with soap and water before you test, or cleanse with an alcohol wipe. We want your hands to be nice and clean before you prick your finger. The test strips, always ensure that those are not expired. I see people in their homes, and a lot of times I'll go and they'll have a lot of older supplies, and they might be using expired test strips, which could affect the reading. So it's important to make sure the test strips are up to date. Again, you're testing before meals or 2 hours after. I'm also a big proponent for recording the numbers. When you see your readings in a chart form, meaning, you know, the date before breakfast, maybe before lunch, before dinner, bedtime, you can kind of see what your patterns are in a much more visual way, rather than having to always go through the history on your meter, which that is there too, but the chart form is something that I'm a big proponent of, and I think it helps you to see what your patterns are. So you might notice after a week or so that your readings are, let's say, high before lunch. Then you can look back and say, well, what am I eating for breakfast? Maybe that is affecting my lunchtime readings, and you can think about decreasing what you're eating for breakfast or changing that around. Maybe you always run low in the afternoon, and by looking at your patterns and maybe you're recording what you're eating, you can see, oh, I'm not having enough carbohydrate at lunch, and that's causing me to run low in the afternoon. So there's a lot of information that comes from these patterns and from writing all these things down. So record keeping is really helpful and really important in managing your blood sugars. Okay. So another topic would be medication. When you have diabetes, there are a number of medications that the doctor may prescribe to help you control your sugars. A lot of times they'll start out with just diet and exercise to control your diabetes. Then they may have to go to a medication. So they'll start with perhaps one type of medication, and if that's not working, then they might add a second medication, a third medication, or they might go to insulin. So as you can see, there's a variety of medication classes and types that you can take to help to manage your diabetes. One of the questions I always get is how, at what point do they have to go to insulin? Nobody wants to go on insulin. It's just a matter of testing, and that's where the testing is really helpful for the doctor to be able to determine whether or not what you're taking is working. So if the numbers are high, even though you're on a medication, they may want to increase the dose, they may want to add another pill, or like I said, go to insulin if the pills are not working. So it's very important to take the medications as the doctor orders. For some reason with diabetes, people sort of do their own thing a lot of times, and that's difficult because if the doctor thinks you're doing a type of the medication one type of way and you're actually taking more or less than they order, they're not really going to know how to adjust those medications. So take them as ordered by the doctor. Take them at the correct times. It's important to ask the question, when do I need to take this? Should I take this pill with food? Should I take the insulin before I eat? And the answer to that is always yes. Insulin is taken before the food. Understand how to use your insulin. If you are taking insulin, very, very important to store it correctly. Insulin that is not in use must be refrigerated. It cannot be left out. Once you start to use the insulin, that particular pen or that vial of insulin can and should be left out of the refrigerator for the life of the pen or the vial. So again, very important. Once you get the insulin home from the pharmacy, it must go right in the refrigerator. Only the pen that you're using is left out. Insulin is only good for a certain amount of time once it's in use. So always check the little storage booklet that comes with the insulin. Every insulin is different. Most insulins are good only for 28 days once you start to use them. After that 28th day, they're no longer viable. So it's important to mark the date that you start the pen so that 28 days later, it has to be discarded, even if there's some left in it. There are some insulins that are good for longer periods of time, some that are good for less. So it's important to know your particular insulin and how long it's actually usable for. We do recommend using a new needle every injection. We also recommend dialing a dose of 2 units in your insulin pen and wasting it prior to dialing your actual dose. Know where to inject the insulin. It's considered what we call a subcutaneous injection, meaning into the skin, not the muscle. So you really want to make sure you're injecting in the correct spot. That would be the back of the arm, the outer thigh, or the abdomen. Good idea to rotate the insulin injection so you're not always doing the exact same place over and over again. So just knowing these things really helps to make sure that you are taking your medication correctly. Know the side effects of your medications. A lot of the diabetes medications will lower the blood sugar, so the side effect could be low blood sugar or hypoglycemia. Some of the medications for diabetes affect your stomach, can cause some bloating, gas, diarrhea, things like that. So once you start a new medication, if you're feeling anything that doesn't seem right, make sure you communicate that to the doctor so that they can either adjust the dose or perhaps try a different medication. Anytime they increase your dose, you want to watch for signs that might be something that is being caused by the medication, particularly low blood sugar. Always keep a list of your medications with you. So when you go to different doctors, they know what you're taking and they won't prescribe something that interferes with the medication that you're already on. So very important to know your medications, know what you're taking, and know your side effects. Okay, problem solving. That's really what diabetes is about. Managing your diabetes, identifying problems, and finding a solution. A lot of that has to do with testing your blood sugar, paying attention to what you're eating, see how you feel. One thing I always run into with my patients in home care is that they will have some high numbers. Their numbers are running high, and they say, you know what, I have an appointment, in March. So when I get to the doctor, I'll let them know what's going on. What I always tell them is call the doctor. If you feel like you're doing everything you can and your numbers are elevated or they're low, let them know. They may be able to make adjustments over the phone, particularly now during this pandemic. We're doing a lot of phone visits and video visits. So don't hesitate to call the doctor if you're having a problem and see what they would recommend. But also too, you can do a lot yourself by charting your numbers, writing down what you're eating, seeing how you feel. That will allow you to come up with maybe seeing where a problem is and finding a solution, whether it's exercising more, eating less, testing more, whatever it may be. That we want you to solve those problems. We want to empower you to be able to take control of your diabetes and figure out what's going on and do something about it. Okay, so again, having diabetes does put you at risk for certain problems. So we do want you to see your doctors regularly. Having diabetes can put you at risk for vision problems. So seeing the ophthalmologist once a year for a dilated pupil exam is a good idea. They can identify any problems and perhaps change your glasses or your prescription. We want you to see the dentist regularly. Most people see the dentist twice a year, every 6 months. Having high blood sugars puts you at risk for gum disease, so it's important to take care of that. We want you to see your primary doctor at least once a year, if not more. They are, again, going to do blood work. They'll do a lipid panel. They'll check your blood pressure. They'll do some tests for kidney function because, again, having diabetes does put you at risk for kidney problems. And then, of course, foot care. We've all heard about people that have problems with their feet when they have diabetes. What happens is if your sugars are elevated for long periods of time, it can put you at risk for neuropathy or nerve damage in your lower extremities. So it's very important to take good care of your feet. You want to, check your feet daily. You're looking for redness, cracks, blisters, sores, anything unusual on your feet that you may not be able to feel, but that you could see. And if you have an issue, you want to talk to the podiatrist, let them take a look and see what's going on. We do recommend a number of vaccines. It's important to get a flu shot every year, your pneumonia shot every 5 years. The shingles vaccine is a good idea as well. And now, of course, hopefully we'll all be getting COVID vaccines soon enough. So that's really important to protect yourself in that way by getting the vaccines that are recommended for you. And you can discuss with your doctor whether you're age appropriate for some of these things. Again, exercising regularly will help you to reduce risk of any complications and help to keep your numbers in good control. And if you're smoking, it's really important to consider quitting. We have a lot of programs at Valley that can help with smoking cessation. And it's just really important because, as we all know, smoking it puts you at high risk for problems. And when you couple that with diabetes or heart disease, it can be very dangerous. So really important to try to get help to quit. And then finally, we like to talk about healthy coping. Having diabetes can be overwhelming sometimes. There's a lot to think about, there's a lot to take care of, and it can lead to sometimes depression, anxiety, things like that. So we want you to pay attention to your mental health as well as your physical health. And if you feel like you're having a hard time coping, know when to seek help. If you've had some sadness or some anxiety that seems overwhelming for more than a couple of days, couple of weeks, talk to your doctor. You can start with your primary doctor and see what they recommend. There's a lot of counseling available out there. Again, a lot of it via phone. You might not even have to leave your house, but pay attention, know how you're feeling. And if you feel like you're not coping well, talk to somebody. Okay. So I think we're set. Those are my 7 ways to manage diabetes. And I think we want to open it up for any questions at this point.
Yes. Cindy, it's Rochelle. So I will be asking some of the questions that the attendees wrote in. And just to remind everybody, if you're calling in through your phone, make sure you're muted just so we don't get feedback. All right. So first question for you. How does fiber affect your carbohydrate intake? Does it offset the carbohydrate that you're eating?
Yes, good question. So yes, having increased fiber in your diet will slow the digestion of the carbohydrates. So we do encourage you to have foods that are high in fiber. That's why we recommend things like whole wheat bread instead of white bread, or brown rice instead of white. So it will help to slow the digestion where you won't get this big spike in blood sugar. It's more of a gentle upward curve and a gentle downward curve, as opposed to if you have something that is like a white bread, it converts very quickly into sugar. You'll get a spike in your blood sugar and then it drops. So the fiber is much healthier and a slower digestion.
Okay. And then I know we encourage people, diabetics, to eat vegetables, but what are some vegetables that are high in carbohydrate?
So yes, all vegetables have a little bit of carbohydrate, but there are certain ones that are higher in carb that are almost considered like a starchy vegetable, and that would be mostly corn and peas are very high in carbohydrates. So they are almost considered like eating a carb as opposed to a vegetable.
Okay. And then the next question, how much does stress affect the blood sugar? How much does it increase?
Yeah, it really has a big effect on blood sugar, and a lot of people are surprised by that, but stress will really, it not only increases the blood pressure, the cholesterol, it increases blood sugar, increases your respiratory rate, all of those things. We call it the fight or flight syndrome. So when we're presented with some kind of a stressor, our body goes into fight mode, and we want to, actually fight or run away. And so in normal times now, in modern times, we're stuck in traffic or something like that. That's a stressor on us. Our body goes into this fight or flight mode, but we're just kind of sitting in our car. And so that all of those things are elevated, but there's no outlet for it. So it really does help you to find a way to deal with stress, will help to lower all of those things. So if you're noticing that, after a particularly stressful day at work, your blood sugar is really high, that's likely why it's happening. So you want to find a way to deal with that stress so you don't have those spikes.
Okay. Another question is, what is the best snack for low blood sugar? And also, do they still recommend like a snack a couple of hours before you sleep?
Okay, so in terms of low blood sugar, we call it the rule of 15. So a 15-gram snack and then wait 15 minutes. So that could be, a half a glass of orange juice. That could be a small piece of fruit. Something that has some type of carbohydrate in it will elevate the blood sugar. It's going to take about 15 minutes to get into your system, which is why, again, the rule of 15. So the 15 grams, wait 15 minutes. And then reevaluate how you're feeling if you're talking about treating a low blood sugar. In terms of a snack before bed, it depends really on how your blood sugars are running. You don't have to have a snack before bed. It's not necessarily mandated or really strongly encouraged unless you're feeling like you're dropping low in the middle of the night. Maybe you're waking up shaky, sweaty. That would mean that your sugar was dropping. So then we do recommend a snack at bedtime to kind of offset that. So it kind of depends on your situation. A lot of times people that are taking an insulin at night, they feel a little bit more comfortable having a snack so they don't feel like they're going to drop overnight.
Okay. And then there's another question here. Can you occasionally have a treat like a cookie or a cheesecake?
Absolutely. What's life without a cookie every now and then? Yes, we just ask that you kind of manage how much you're eating. I was saying with snacks, we recommend to stick somewhere between 15 and 20 grams of carbohydrate per snack. And that can be a couple, like in the afternoon and maybe in the evening. So it's not that you can't have the snack. And, even if you want to go a little bit higher than that on a holiday or something, it's more about what you're doing most of the time. So absolutely, every now and then you can have a snack. I would say if let's say, it's, Christmas Eve and you love to have your apple pie on Christmas Eve, maybe don't make that the night that you have pasta for dinner. If you kind of want to balance it so that you're not having too much all at once, your body has a hard time handling that big sugar overload. So a little bit at a time, and once in a while, a snack is absolutely okay.
Okay. And then I have a friend who has a continuous glucose monitor, and sometimes she would say that there's some discrepancy between that and a finger stick. Does that happen often, or is it particular meters?
It's normal for the continuous glucose monitor have a different reading than the finger stick. The CGMs, the continuous glucose monitors, are measuring the glucose in your interstitial fluid, which is always going to be different a little bit than the blood glucose reading. So we try not to compare and contrast all the time. You're going to kind of stick with one or the other. Every now and then you'll have to double check the CGM with a blood finger stick just to make sure it's not way out of whack. It shouldn't be very, very different, but it is going to be different. That's a known thing with the CGMs.
Okay. Another question is, I noticed that my blood sugars are always higher in the morning. What could that be attributed to?
So a couple different reasons. There are hormones that are produced overnight that sometimes cause the sugar in the morning to be a little bit higher. And if that's the case, they'll usually talk to your doctor about certain medications that might help with that. And then there is the possibility, although this is rare, that your sugar may be dropping overnight. And when your sugar goes low, your liver will release stored sugar into your bloodstream to kind of counteract that low. So if your sugar's dropping overnight, that liver might be producing excess sugar that will cause you to wake up with a higher number. So just for fun, I always recommend, if people are having higher numbers in the morning, to have a bedtime snack and see if that takes care of that low blood sugar overnight, causing you to have a more normal reading in the morning. Again, that's a little bit rare, but it's always something you can try. If that doesn't do anything and you still wake up with higher numbers, then I would say talk to your doctor about what medication might be appropriate for you to combat that.
Okay. This is on dietary fiber again. Does it count as part of the total carbs? And what is its effect on blood sugar? I think you've answered the second part, but does it count as part of the total carbs?
So we don't really get so into that unless you're taking insulin and you're adjusting your insulin based on your carb count. But if the amount of fiber is over 5 grams, then yes, it can kind of take away from some of the carbohydrates that you're consuming. They say to subtract half of that amount from the carb total. But again, that really comes more into play if you are adjusting your insulin based on the amount of carbs that you're eating. Other than that, it's just a good idea to have fiber in your diet.
Thank you, Cindy. Can you just go over how we can sign up for the diabetes self-management class? What's the usual process? What does it entail?
Yes. So
you need a doctor's recommendation, etc.
Exactly. So the diabetes self-management class it's actually a 4-week class. It includes meeting with myself or our registered dietitian for a one-on-one assessment, and then it will be 4 weeks of classes. The classes are 2 hours each. It does require a doctor's order. There is a charge for it, but most insurances will cover it. I'm going to give you the phone number that you can call if you were interested in getting more information. That number is 201-447-8219. Now, I will tell you that right now we are in the midst of planning for this next class to be virtual. We're sort of still in the planning stages, but we're looking at, I believe, February for that class. So you can get more information via that number. The other thing that we do offer at Valley is a diabetes support group. And again, this is being done virtually. We've been doing this all through the pandemic, and it's gone really well. Facilitated by one of our registered dietitians, and she oftentimes has a guest speaker, and then there's just a lot of back and forth discussion, different topics. That is the 4th Thursday of every month from 7 to 8:30, except for December and August. So that you can access, you can send an email to jherman, So that's JHERMAN@valleyhealth.com. And just let her know that you're possibly interested in the diabetes support group. No charge for this. This is completely free. And again, it's virtual. So it would be a similar format to Microsoft Teams. And
Okay.
those are our programs.
Thank you so much, Cindy, for your informative presentation this evening.